International aid is arriving in India as the country continues to be overwhelmed by a catastrophic new wave of COVID-19. Hundreds of containers of oxygen have arrived from the United States. It's also sending over raw materials to help boost vaccine production. The UK is dispatching ventilators.
The pressure on hospitals in India is getting unbearable, and we're going to do our part to make sure our friends India get all the support they can. We obviously, if you remember, commissioned huge numbers of ventilators to alleviate the pressure on the hospitals, and it's only right that we share and help them at their time of need.
There are more than 352,000 new cases, the fifth straight day of record infections. Delhi is the epicenter of the new outbreak, with no more ICU beds available anywhere in the city. For the latest, let's join Ishan Garg. Ishan, medical authorities are now urging people to stay home if they have milder cases of COVID.
Yes, that's absolutely true. In fact, health officials have been saying this for a very long time, especially the ones who are affiliated with the Indian government. The official guideline from the government now is that anybody who's got their oxygen levels upwards of 92%, they need to stay at home. They need to be in consultation with a physician and have their symptoms regularly checked by one of their doctors, perhaps even a family doctor. But the problem is that a majority of India's population cannot actually get in touch with a doctor or even have access to a medical healthcare facility either nearby them or even virtually. So that creates a problem for a large number of people. Secondly, there are several people who are saying that despite having all symptoms of COVID-19, they are testing negative for the disease because of perhaps this new doubly mutated variant of the virus. Impact of COVID-19 is showing up on their CT scans, and they're still not being admitted into hospitals. Now, government says that if India is able to keep a lot of moderately ill patients at home, the oxygen crisis could be shortened. But experts say that the only way to actually solve this problem would be to increase production of oxygen or at least divert supply from commercial to medical use.
Ishan, state elections are going ahead in West Bengal today. Why aren't they cancelled given the ongoing crisis?
Well, this is a question several experts and critics alike are asking. Several critics of Prime Minister Modi are saying that the government went ahead with the elections and the plan for it because Prime Minister Modi's party wanted to consolidate power in the upper house of the parliament. At the same time, the High Court of Madras in the state of Tamil Nadu has pulled up the Election Commission, the apex body responsible for holding elections. It's completely criticized the body, saying that they should be cases of murder registered on the officers who are going out there conducting elections, because elections and rallies with tens of thousands of people gathering every single day is perhaps responsible for tens of thousands of people contracting COVID-19. The court has also said that when everything is, when the courts had made sure that Election Commission has to ensure COVID protocols being followed at the rallies and at polling stations, none of that was done. So the court is also ready to launch a formal complaint against the Election Commission because of this. But health experts are saying, well, that might not be of any use because the damage that had to be done because of those massive gatherings has already been done.
All right, Ray, thanks for that. Ishan Garg speaking to us from New Delhi.